coming now to know where to locate information, reliable information from Saab Medical Library's webpage. Let's go there. As you can see, our webpage is built as user interface friendly as possible to tackle each of our audiences, the nurses, the patients, the physicians, the public health practitioners, with resources on services, clinical research tools, more resources, and then frequently used databases. For you as physicians, I advise you come here. It's a hub where all information is there about EBM medicine, where to find guidelines, how to locate a particular article, steps on that, looking for information, boosting your research impact, drug information, core journals and books, challenging your knowledge. For example, we buy all board vitals for you. They are questions and answers. They can be in the form of a test or in the form of practicing. You can also look up study tools under Access Anesthesiology, Medicine, and Pediatric. You can challenge your knowledge in the following as well. One another thing is changing your practice. Because of Dr. Sidney Burwell's, there's the Dynamed that offers like an RSS or an update for you upon change in the practice of a specific specialty. Do's and do nots. There's also up to date. There's this thing called choosing wisely. So for example, if I have a patient with pylori, it's a culmination actually. What is this about? On the culmination done by the ABIM from different societies to help you find recommendations on the point of care spot, so that we do not go into overdosed practice. We do not want to bombard the patients and the healthcare cost to pay more for the tests and procedures. So for an example, I'm giving you one. If I have a patient with pylori, he's an outpatient, say, and he is a pediatric. I don't want to limit the search. I want to keep it open. So the American Society of Clinical Pathology would not recommend requesting serology H. pylori. We use the stool antigen or breath test instead. That's a really great tool. Another great and most important tool of them all, and this is the wow of what we culminated in SML, is the evidence by specialty. This is done by McMaster, and it accumulates upon you coming and filling up this form. Don't choose more than 3 specialties. And this is done for AUB doctors and non-AUB doctors across. If you come and just fill your name, email, and we will do the necessary registration for you, and of course choose your specialty, you will be receiving secondary form papers that is evaluated, clinically evaluated, and clinically significant, peer-reviewed, critically appraised articles, summed up articles. They're not original papers. They're not a whole original paper. They're summed up. There's a JAMA article that said that the doctor had around, for him or her to be updated, he or she has to read 17 articles per day when he or she has 45 minutes per week as free time, or a time for him or her to update him or herself. That was in JAMA 1992. And I'm sure if it were, this study has been done now, the 17 articles would have jumped to 30 articles, I don't know, and the 45 would have been decreased to 15. It's just like me and my grandma. My grandma used to have all the luxury, didn't have the luxury in the world. No washing machine, no drying machine, no nothing. And she still managed to finish all the house chores easily with more children. When I, with a single child, and all the luxuries in the world cannot find the time. So automation didn't come to replace, but it came to complement, and that's why this is most important for you to stay updated. You will be receiving those updates weekly if any updates come up to your email by just you coming in. So please spread the word for you as AUB and non-AUB people. This is free. One other tool I like it is ClinicalKey, where you can find ClinicalKey. You can look into procedure videos. So for example, this actually is a database that contains journals, books, clinical overviews, clinical trials, patient education, multimedia, and procedure videos. So for example, I want to look up into laparoscopy, and I filter by procedure videos, and I click again OK. You will be able to watch the video here. That's wow. If say I want images about this particular concept, the nice thing about it is that some images are actually, these are videos, I want an image. You can add them to your PowerPoint presentation with the citations with them, done automatically. All you have to do is register the first time and sign in every other time. This is a very nice database. It contains all of these tools for you, along with the guidelines, along with the clinical trials, along with the book chapters, and patient education. For your patients, doctors, for your patients, what do you advise them? I advise them to go to this LibGuide, but most importantly to go to MedlinePlus.gov. This is a free database that has a layman language form of talking to your patients, for them to be able to know what are their symptoms, their diagnosis. They can be written in Arabic as well. So for your patients, you come and click here, and this is the LibGuide for reliable resources. There's a symptom checker, what to ask your doctor, choosing wisely, again, tackled for patients this time. But MedlinePlus.gov, it's done by the National Institute of Health. This is a very reliable resource and updated, and quite frankly, I have a nice example of it. During my second master's in the US, you know how expensive the healthcare is there. So I had an episode on March 2018. It was like super harsh. It was harsher than me delivering my kid. It was that unbearable pain. And I am a person who holds up such a threshold. So I didn't give and take because I'm a healthy person. So usually when you're a healthy person, you don't overthink stuff. Then this episode happened again in April, 2 weeks afterwards. So the first time I thought probably because I ate so much. The second time probably because I'm going to be having my period soon. Then it became more frequent, time after time, and the span of time is decreasing. It was like two weeks. Now it's shorter. Then I said to myself, well, I teach people to go to MedlinePlus.gov. Why me not to go there? Why me not to check it out? And I actually went there and typed in pain from the upper abdomen, switching back, right side, and I diagnosed myself. And when I came back, I actually was admitted to the ER, and actually, yes, I had the bladder taken from me. I had to have a surgery for the bladder to be taken. So MedlinePlus.gov is a reliable resource. So when patients come to you and tell you, I Googled this, no, tell them not Google. there's this MedlinePlus.gov. Write it down as a prescription, like you prescribe for medicine. That's a great tool. Other than that, so looking up articles, you know how to go about that. Wait, let's go back to the SML. By looking up an article, the evidence-based medicine, the library catalog, Lebanese corner, meeting with a librarian, asking a librarian, chatting with a librarian, so on and so forth.